Fallopian tube, also called the uterine tube or the oviducts. Paired muscular tubes transport the ovum from the ovary to the uterus. They are the site of fertilization and play a crucial role in the early embryonic development. Anatomy of the fallopian tube: length 10 to 12 cm. Location: extends laterally from the uterus to the ovaries in the upper pelvic cavity. Position: lies within the broad ligament with the mesosalpine suspending it. Parts of the fallopian tube: fimbriae, finger-like projections near the ovary, help capture the ovum during the ovulation. Infundibulum, funnel-shaped opening near the ovary, contains the fimbriae and opens into the peritoneal cavity. Ampulla, longest and widest part of 5 cm. Site of fertilization where the sperm meets egg. Isthmus, narrow, thick-walled part near the uterus, act as a sperm reservoir and regulates the embryo transport. Interstitial, intramural part, short segment that passes through the uterine wall, opens into the uterine cavity. Histology of the fallopian tube: mucosa, lined by the ciliated columnar epithelium. Cilia beta towards the uterus, helping the ovum and the embryo transport. Muscular layer, inner circular and the outer longitudinal smooth muscle peristalsis assist in the ovum transport. Serosa, outer peritoneal covering, continuous with the broad ligament. Blood supply, nerve supply and the lymphatic drainage. Arterial supply: ovarian artery from the abdominal aorta, uterine artery from the internal iliac artery. Venous drainage: ovarian vein, right to IVC, left to renal vein. Uterine vein, internal iliac vein. Nerve supply: sympathetic T10 to T12 ovarian plexus. Parasympathetic pelvic splenic nerves S2 to S4. Lymphatic drainage: para-aortic and the internal iliac nodes. Functions of the fallopian tube: ovum capture, fimbriae sweep the ovum into the infundibulum. Fertilization occurs in the ampulla. Early embryo transport: cilia and peristalsis move the embryo towards the uterus. Sperm transport helps the sperm move towards the ampulla. Clinical conditions related to the fallopian tubes: ectopic pregnancy, implantation of the embryo in the fallopian tube, most commonly in the ampulla. Pelvic inflammatory disease, infection causing the tubal scarring and the infertility due to the chlamydia gonorrhea. Hydrosalpinx, fluid-filled blocked fallopian tube, often due to the chronic infection. Salpingitis, inflammation of the fallopian tube. Tubo-ovarian abscess, severe pelvic infection leading to the pus accumulation. Fallopian tube cancer are primary carcinoma of the tube, often serous carcinoma. The fallopian tube transports the ovum from the ovary into the uterus and is the site of fertilization. Divided into 4 parts: infundibulum with the fimbriae, ampulla, fertilization site, isthmus and the interstitial part, lined by the ciliated columnar epithelium which help in the ovum transport. Blood supply like ovarian and the uterine artery. Venous drainage via ovarian and the uterine veins. Ectopic pregnancy most commonly occurs in the ampulla. Pelvic inflammatory disease can lead to the tubal scarring and the infertility. Hydrosalpinx, this is a fluid-filled blocked fallopian tube often seen in the chronic infection. Salpingotomy, removal of the fallopian tube, is performed in cases of the ectopic pregnancy or the severe infection.